Welcome to ExpertVue Episode 1, sponsored by Vuetech Health Innovations, a new series where we are going to meet experts in the fields of biotechnology, healthcare, and aging. I'm your host, Amal Baloo. Today we have Dan McKinzie, a registered occupational therapist and a master pain practitioner. He will be sharing his insights on how Vuetech's emergency video alert system, EVA, will revolutionize care for our vulnerable elderly population and the healthcare system. Thank you so much for being here, Dan.
Well, thanks for having me. I appreciate it.
Of course. Let's get right into why you're the expert.
Okay, well, I'm again, senior living, industry leader. Been doing that for a little over 20 years. Obviously with senior living, we have several different types of service lines. So we have what we call skilled nursing, which is more of acute rehab, long-term care residents, assisted living, independent living. So we basically cover the entire continuum. And, the number one, I'd say challenge or obstacle is preventing falls. The amount of energy and time we spend on that is astronomical, as you can imagine. So it's probably the number one metric that we are most concerned about. In fact, we really call it fall risk reduction. You can never really fully prevent falls, unfortunately. So when I came across Vuetech innovations, I immediately thought, well, gosh, we should have had that 10 years ago because of the predictive nature. We can actually see trends emerging, whether it's poor posture, a gait imbalance, bed positioning. There's a number of things. So I believe this technology has the potential to absolutely be a game changer in the industry. And you look at the impact of falls, it's trauma, typically, it's a fracture of some kind, hip fracture. So then you think of the hospital course and all the complexities and issues that come up. We call sequelae of events, and that could be pneumonia, and even death in some cases, unfortunately, because when people are immobile for a period of time, their health diminishes rather quickly. So with Vuetech, I see that as preventing hospitalizations in the first place, even readmissions into the facility, and we can keep people home much safer and hopefully quicker. And obviously, the family places a lot of value on that. Their loved ones being taken care of with that type of technology that can predict. And I think that's really the crux of all this. I think the predictive nature, and it can even help drive therapeutic interventions from a therapy perspective. So if we're seeing trends emerge, that can actually kind of help drive our treatment plan.
Right.
And those are just a couple of examples.
Yeah. So can you elaborate on the individualized treatment plan that you were just talking about?
Sure. So, from a therapy perspective, whether I'm talking about occupational or physical therapy in particular, we do what we call standardized tests or assessments. We thoroughly evaluate the patient, which is common, what we typically do. But oftentimes we don't really know the source of where it's coming from, if that makes sense. It's kind of a best guess of what might be going on or contributing to the falls.
Okay.
So I think with Vuetech, it gives a pretty clear metric or pattern of what's happening. And that would also kind of help drive our intervention process.
Okay. So if it's like more of an environmental issue that's causing the fall, or if it's more of like a physiological issue causing the fall.
Exactly. It could be simple things, environmental clutter.
Okay.
It could be a trash can throw rug in the way, a number of things. We can actually capture that on the emergency video alert. And we might be able to see patterns too, where it's taking them longer to go from a lying down position to sitting up in bed. Maybe it's taking a minute, 2 minutes longer.
Yeah.
That tells us that, gosh, there's probably a core instability or some postural weakness at play. Okay. So that tells us a lot clinically.
Yeah. And that would definitely change how you address the issue with the family and the elderly patient.
Absolutely. And of course, you think about all the other caregivers involved, nursing aides, all the entire nursing staff. I mean, they actually can be kind of cued in as to what's happening. And they can also kind of monitor that throughout the night when we're not there.
Yeah. So how else could EVA help nursing aid and like healthcare workers involved in the care of the geriatric population?
Sure. Well, it seems to be kind of an industry-wide issue right now is, staffing. We look at staffing ratios, making sure that they're adequately staffed throughout the night, especially third shift. And,
Yeah.
when you have caregiver stress or burden, as I call it, that often plays a valuable role. Because if you think about it, if we're short staffed in a particular facility, it can allow the immediate notification that
Hmm.
event's getting ready to happen or there's a certain risk that can also free up other caregivers to do more other things. Maybe the registered nurse as unit manager can actually attend to other important things.
Yeah.
And it gives the nursing aide, for example, a heads up that, hey, there's a trigger here, something may happen, there's a high risk.
Yeah.
So that can make an absolutely huge impact on staffing in particular.
Right. Yeah. How do you think COVID-19 um, and like Eva, like how could Eva help through this pandemic in the hospital?
Certainly. I've seen firsthand, being on COVID, positive units, we call them, red units, where these folks are isolated.
Yeah.
So, the door's shut, they're on droplet precautions perhaps. And
Yeah.
you can imagine we don't know what's going on inside the room. I mean, we don't really know if there's going to be a high risk event.
Hmm.
So in times of COVID, I think this is actually a perfect technology to have. I wish we did, again, I wish we'd had it yesterday.
Yeah. Yeah.
Uh,
Um, yeah, I mean that makes sense because if you have the camera in the room and like nurses have to come in and out right now, healthcare workers have to come in and out and wear PPE all the time, and so that can like reduce the need for doing that. If you don't have to keep going in every hour to check on what's happening, you have this camera this monitoring system to tell you what's going on in there if you even need to go.
Absolutely. And the other unfortunate aspect of this, and I'm pretty sure this is industry wide,
Yeah.
because of COVID and being isolated, and we've seen a major uptick in falls.
Yeah.
Then you think of other things. It could be wound development,
Yeah.
unfortunately, pressure ulcers, depression,
Yeah.
being isolated for a period of time, away from family.
Yeah.
So again, it just makes perfect sense to me to have this technology in place, and
Okay.
especially in times of a pandemic.
Hmm. How else do you see Eva impacting the healthcare system?
I mean, a number of things. We look at clinical outcomes. They're very important to us. We want customer satisfaction,
Right.
quality of life. We want not only the patient, but the family members to be satisfied with what we're providing.
Hmm.
So I see that making a huge impact. But you can also look at it from the provider's perspective, which is cost-effective healthcare. If we have so many different rehospitalizations, they have a fall in our facility,
Hmm.
they go to the hospital, they either get surgery or some other intervention. That's really costly. You can imagine just healthcare dollars in general. I'm not really sure the statistics exactly, but we spend probably billions of dollars on falls every year.
I think it's
So
like
if you really
50 billion a year.
okay, yeah,
It's a high number.
absolutely. That's it. So that's really a huge cost to us, and not to mention I mentioned before these still events that come with it. Whether it's pneumonia,
Yeah.
skin issue, integrity, that type of thing. So it just impacts the entire healthcare system, in my opinion,
Yeah. So with Eva, you would say that the healthcare system costs would decrease tremendously?
tremendously.
Tremendously.
Yeah, I've certainly seen that firsthand. And you think about the amount of time that we spend,
Mhm.
in a facility on reducing falls. It's like I said, astronomical.
Yeah. How do you think insurances would react to Eva?
Very favorably.
Yeah.
Nowadays we're seeing managed care contracts with certain providers.
Mhm.
And again, with something like Vuetech in place, that's obviously going to save them a lot of healthcare dollars and knowing that the residents are being taken care of appropriately.
Mhm.
Um, so yeah, I mean, I think that's also another dramatic impact in the industry. It's definitely a game changer.
Okay. How do you think Eva compares to the current technologies that are out there for fall prevention or fall detection?
From what I've seen, in the research that we've done, there's nothing compares to it. I mean, you think about, you can have a video of an event that occurred, which is great. It's certainly an improvement, but it
Mhm.
doesn't actually tell us the core reason or cause of the fall.
Okay.
So again, it's obviously HIPAA compliant. It's not a live video stream. It only captures that event
Mhm.
or even before the event. So we can actually it's the predictive nature. That's really there's nothing else like it on the market. And to me, that is so beneficial
Mhm.
from a clinical standpoint.
Right. So with Eva, like monitoring families, loved ones 24/7, how do you think they would feel about this sort of monitoring system and their loved one's privacy. What's your
Oh,
take?
absolutely. Yeah, I mean, peace of mind, I know, for my parents, in a facility and, maybe if I'm not close to them and you're always wondering what's going on during the day and at night, are they being supervised appropriately? That
Hmm.
solves that issue. So for me, I think, as a family member, would love to have something like that in place. And this also applies to, maybe the home health setting,
Okay.
which is becoming more popular. People want to be at home,
Yeah.
and age in place, which makes
Yeah.
makes a lot of sense. So I think, the family members can monitor this remotely, and they can see all these emerging trends or patterns, and you can basically address the problem before it occurs.
Right.
And that's the ultimate goal.
Yeah.
A lot
Yeah.
of value in that.
Can you elaborate more on the home health aspect?
Yeah. So I mean, you think about home health. Typically, they're not seen every day. Um, I'd say 2 to 3 times a week at most, typically, if you have all disciplines involved, whether it's occupational, physical therapy, and maybe nursing. So that's only 2 to 3 days a week. So again, I think that's the value is you can actually see things coming up, maybe it's posture, gait,
Mm-hmm.
bed positioning, the number of times they're up at night, so all those parameters you can successfully monitor. So that also obviously makes the home health treatments a
Hmm.
whole lot more effective.
Yeah.
And also the family can see this and they're also involved,
Hmm.
which could mean checking on them more frequently during the day or week.
Hmm.
So this actually affects all facets of care if you think about
Yeah.
it, including family involvement.
Okay. So I guess if you had to sum up Vuetech's Eva in like a couple of sentences, what would you say?
Yeah, I think it has the potential to change the entire healthcare industry, and it goes down all layers. I mean, whether it's like I mentioned before, skilled nursing, obviously, home health, the assisted living, um, independent living, apartments for seniors, and of course hospitals too. Obviously that's vital. So it really, in my mind, it
Yeah.
plays a major role across the continuum of care,
Yeah.
whether it's acute care or post-acute.
Right. Post-acute care. Would you mind talking more about that?
Yeah, post-acute care can refer to maybe acute rehabilitation facility or a freestanding rehabilitation facility.
Okay.
Those are more acutely related, so it's more of like a intensive therapy. So I
Okay.
think it would apply to that setting as well. Post-acute care could also mean a skilled nursing facility or nursing home.
Okay. Okay.
We have what we call, short-term rehab services. So obviously, it'd be very applicable to that setting as well.
Okay. Okay. All right. So thank you so much for sharing your expert insight with us.
Well, my pleasure. Thanks for having me.
Is there anything else you'd want to throw in at the end here?
No, I just think it's a really exciting time with these types of innovations. I've always prided myself on trying to find new innovations, what really works, and obviously it's all the benefit for our patients and residents. And like I said before, this is an absolute game changer in my mind.
Yeah. Yeah. Great. Well, thank you so much.
Thank you. I really appreciate the opportunity.
Yeah, thanks. And thank you to all of our viewers. Be sure to follow Vuetech Health Innovations on Facebook, Instagram, Twitter for any updates on EVA and for our next ExpertVue episode. Thank you.